Hi everyone, very good morning and welcome back to Crack Grade B. So let's start our Ministry of Health schemes, right? Today we are going to complete two very important topics, and let me say, if I'll tell you that one of these topics is utmost important. So first of all, we are going to see few of the aims and objectives under National Health Policy, right? And after that we'll be going to see Ayushman Bharat scheme and its various components like health and wellness centers, PMJ and other schemes which the government has launched under the Ayushman Bharat, right? So let's get started and talk about National Health Policy. So watch it over, National Health Policy 2017. This document came in 2017, and what is the aim of our health sector, or what aims government wants to achieve in the near future? For that, this particular document has been made. So you will see that there are so many aims as well as objectives. Government has given itself targets. We are going to cover this particular document very briefly because it is not that much important, but still having a read is always advised, correct? So let's see what do we contain under National Health Policy. So under this, government has informed, strengthened and prioritized over these particular areas that we have to work. Government said that we have to work in investments in health, prevention of disease, technology access, strengthening regulation, developing better financial promotion strategies, etc. Obviously, any government would like to want these particular health related factors in their governance. Next is health status and program impact. Now, what they do want to achieve, what are their aims in order to do with the health? So these are that particular data. Increase the life expectancy at the birth from 67.5 years to 70 years by 2025. Again, this is the target which is given by the government to itself. Next, decrease the total fertility rate to 2.1 at the national and subnational level by 2025. Establish regular tracking of disability adjusted life years. Decrease under 5 mortality rate to 23 and MMR from current level to 100 by the 2025. Decrease neonatal mortality rate to 16. Achieve global target of 90-90-90 by 2020 for HIV AIDS. Now this particular thing can be important. This is a little bit data. They can tell you that what is the global target related to 90-90-90. So this is related to AIDS, right? What we want to say under that, 90% of all the people who are living with HIV, they know their status. That means they are aware that they are having a disease called as HIV. Next, out of that 90% that have been diagnosed with HIV, they receive ART, antiretroviral therapy, that we have seen yesterday. And 90% of those receiving ART, they should have viral suppression. That means the virus of AIDS that is there, that should have suppression. That means your medicine should actually work. So this is the aim of 90-90-90. You can remember it, right? That's a little bit of data. Then you have got achieve, maintain, elimination status of leprosy, Kala Azar. We have got new targets for it, right? For leprosy, Kala Azar as well as lymphatic filariasis. Then what about health system performance? We'll just see this quickly because this is just a factual data. Increase the utilization of public health facilities. Antenatal coverage we have to sustain greater than 90% by 2025. 90% of the newborn, these are fully immunized by 1 year of age. Meet needs of family planning. Access to safe water. Decrease in the current tobacco use by 15% and by 30% in 2025, and decrease 40% prevalence of stunting. So these are all the aims of your national health policy, a general kind of aims. And what this national health policy works as, this works as a blueprint. Like it shows the way to the government that what kind of way they have to take in order to achieve their objectives, right? So national health policy, they work as a guidance tool. Now Having given all the targets under National Health Policy, the government came up with its flagship scheme that is called as Ayushman Bharat. We are going to see various components under Ayushman Bharat, right? Like provision of medicines, provision of insurance related to secondary and tertiary care, right? Apart from that, health and fitness, health and welfare centers, right? So all these are the components of your Ayushman Bharat. Now, let's start from here because that is the data that has been a repeated one. So on September 2021, the Prime Minister, they announced the nationwide rollout of Ayushman Bharat Digital Mission. We are going to talk about Ayushman Bharat Digital Mission in a bit, right? In 2018, India has launched Ayushman Bharat. It is one of the most ambitious health missions ever. Now, what we want to achieve under Ayushman Bharat, so these are the four components, four pillars that we want to achieve. First one is health and wellness centers, right? Under this, what we want to do, we want to provide the primary healthcare services. Apart from that, we want to also do screening of communicable, non-communicable diseases so that patient can be referred to a secondary or tertiary care unit on time. So these are a comprehensive structure of health and wellness center. Then you have got Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat Digital Mission, and then Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. See, on every kind of component we have worked upon. First of all, we have seen that, okay, on primary grassroots level, we should be having an infrastructure in order to provide the better primary care to all the individuals. Then we thought about insurance, right? So there are families who are deprived and they cannot afford to go for secondary or tertiary care. Hence, we have made provision for the insurance so that they should not be facing financial difficulties. After that, digital component you have got, you will see that there is a number that is allotted to every patient. Apart from that, there is also component of the health registry as well as where are your professionals, what are the health infrastructure or what are the hospitals that you can go for. So all these data are the components of your digital mission. And lastly, we have also seen the health infrastructure mission. Just wait for a second. Yeah. Now, we will be talking about all of these four components one by one. First of all, we have got National Health Protection Mission. So, Rashtriya Swasthya Bima Yojana, that has been covered under this. Now, what we want to actually cover, we want to address the primary health, secondary as well as tertiary level health. Ayushman Bharat, it is a flagship scheme of the government as recommended by National Health Policy. Very important point. Ayushman Bharat formation has been recommended by our National Health Policy. Next is to achieve the vision of universal health coverage as well as to meet sustainable development. Now, under this health protection mission, who are going to be the beneficiaries? So, it is going to target 10.7 crore poor, deprived rural families and identified occupational category of urban worker families as per the latest socio-economic caste census covering both rural and urban. We are going to see the list of beneficiaries in detail, but let me tell you, like in urban areas, you have got the people who do a menial kind of work like a rickshaw puller, a peon or a construction worker. So these are called as the occupational category of deprived people. Because of their occupation, they are not considered as well established. Hence, they are called as the deprived ones. Fine. So next thing is implementation strategy. Who's going to implement? So at the national level, we have got a National Health Protection Mission Agency, and at state level, we have got state health agencies. Now talking about Pradhan Mantri Jan Arogya Yojana. So first of all, going for a bit history, right? Before this particular Jan Arogya Yojana component, there were two schemes that were earlier working. One was Swasthya Bima Yojana. Under that also poor families were covered, and then there was a scheme for senior citizens separately, right? In both the schemes, 30,000 was the amount of insurance or amount of cover that was provided to these disadvantaged people. 30,000, right? But under PM Jan Arogya Yojana, we have got a 5 lakh insurance cover. So obviously it is an upgraded version. Let's just see a briefer intro of what was the history, right? So under PM Jan Arogya Yojana, who were its predecessors? So we have got Rashtriya Swasthya Bima Yojana, and we have also got Senior Citizens Health Insurance Scheme. So your Swasthya Bima Yojana was launched in the year 2008 by Ministry of Labour. Aim was to provide health insurance to unrecognized, unorganized sector, and the premium which it was charged was 30 rupees per annum from the below poverty line families. Now what was the coverage of this particular scheme? So inpatient medical care up to 30,000 per family per annum was provided. Only secondary care hospitalization, and it was transferred to Ministry of Health from Ministry of Labour from effect of 2015. Can you guys tell me that what does secondary care means? I have once explained you this. Can you please tell me that what does secondary care means? Secondary care. Any answers? By the time I cover senior citizens, please try to give the answers for it, right? Now next is your Senior Citizens Health Insurance Scheme. Same thing. What we wanted to do, we wanted to provide all those people who are more than the age of 60 years. Good, Gaurav. Inpatient medical care up to 30,000 per family per annum, and premium is not charged from them because it has been provided from the Senior Citizen Welfare Fund. Now these were the two insurance schemes that were providing the cover earlier, but later they got subsumed under the Pradhan Mantri Jan Arogya Yojana. Now we are going to see Pradhan Mantri Jan Arogya Yojana. What are the benefits of it? Right? What are the things that are covered under it? Who are going to contribute the premium and everything? Please read it very carefully because it is an important component of your Ayushman Bharat. Now let's see. PM Jan Arogya Yojana launched in the year 2018, right? Aim is what? To reduce the financial burden on poor and vulnerable group arising out of the catastrophic hospital episodes and ensure that they have access to quality health service, right? Now beneficiaries, who are going to be the beneficiaries? To 10.74 crore poor and vulnerable families, right? Approximately 50 crore beneficiaries have been covered. This has been the coverage under this particular scheme. Now see over here, on an average we have assumed that there will be 5 members per family. That is the criteria we have taken. Now poor, who are all covered under this? Poor, deprived rural families, identified occupational category of urban workers families as per the latest socio-economic caste census data. Both rural as well as urban families are covered. Please remember this. Next is all families who have been enrolled under Swasthya Bima Yojana not being featured in the targeted group of socio-economic caste census, that is also covered. What is the latest socio-economic caste census that is available to us? Latest socio-economic caste census. Now what does it covers? Their PDF is available in the paid course. Now coverage. Coverage is secondary as well as the tertiary care hospitalization is covered under it. Right, I have already told you secondary care means the expert related guidance as well as medications that are provided, and under your tertiary cares there comes the high end surgery operations and other things. Yeah, so other things that are covered by the experts. So these are your secondary as well as tertiary cares, both are covered under this particular scheme or under PM Jan Arogya Yojana. Benefit features: hospitalization cover up to 5 lakhs per entitled family per year. What you have to remember, the entitlements are for per year per family, not for individual. We have got 5 lakh rupees per family. And then the other thing that you should be remembering is it is covering both secondary as well as tertiary care, where you can already see that under Swasthya Bima Yojana only secondary care was included. Now entitlements based scheme. What are the benefits under this? We are going to see. First of all, no formal enrollment process is required. There is no cap on family size. Whether you are a family of 4 or you are a family of 6, not matters, right? Age of members does not matter. Everyone is covered under this, especially girl child as well as senior citizens, they are covered. Next, free treatment available at all public and impaneled private hospitals. Always look for the contradictory information. Here you should be remembering that where you can get the hospitalization. So you can get in all public facilities as well as impaneled private hospitals, all these hospitals which have registered themselves in order to provide the PM Jan Arogya Yojana. And one more thing, once these hospitals have impaneled themselves, there is a third party audit being conducted on them. They are not left like that. Even if they have registered under a government scheme, their services that they are providing to the customers, that will be checked whether they are providing quality service or not, and depending on that we are going to provide them the compensation under this particular scheme. Next is cashless and paperless access to the quality healthcare services, and followed up by benefits of national portability. You can take the benefits of this particular scheme from anywhere in the nation. All pre-existing diseases have been covered from the day one. So these are the benefits of this particular scheme. Now talking about from where you can, if you want to know whether you are eligible or not, these are the toll-free numbers where you can contact, or there is also website of PMJ. There you can check whether you are eligible under this or not. Talking about insurance premium as well as the coverage. So insurance premium, obviously you are providing an insurance cover, someone has to bear the premium. So under this particular scheme, it will be shared between central and state governments in the specified ratio of 60:40 for all states, and UTs with their own legislature, and 90:10 in the northeastern states and 3 Himalayan states of Uttarakhand, and 100% funding for UTs who are without legislature. Now the states are also free to continue with their own health programs, but there are states who are not continuing with this particular program. Can you tell me what are these states? There is a state which is not continuing. There are 2-3 states as well as UTs who are not continuing with this particular program. If you have any idea, please tell me. Otherwise, we are going to cover them. Yes, West Bengal is one of them, right? Now, what is the coverage under this? So, it covers 3 days of pre-hospitalization and 15 days of post-hospitalization expenses like diagnostic, medicines, etc. related expenses. MEDCO is the medical coordinator at the hospital. It is designated to look the facilities at the hospital. Treatment can be facilitated to the patients who have produced the card before dispatches. Minimum 24 hours stay is required for this, and there are health benefit packages. Health benefit packages talk about that what kind of services has been included under this particular scheme, right? So that is the thing. Now what have been included under the package rate. So these are all the things, all the kinds of services that are included, like registration, bed, nursing, surgeon, anesthesia, blood transfusion, medicines, prosthetic devices, pathology, radiology tests, food to patients, pre-hospitalization, post-hospitalization expense, and any other expense that is needed to be covered. Yeah. So therefore the point here is that the government has allowed that if you want, you can, there is no compulsion to be get registered under this, right? But the state governments, if they want, then they can follow their own schemes as well. Who's going to implement this? So National Health Authority across the country, this National Health Authority, we are going to see the composition of this. Union Minister of Health, he is the chairman of this particular authority, and it is seeing the implementation of these particular schemes in the national level. State health agencies, and we have also got district health implementation agencies. Now a very important component that comes with the eligibility. We already know that eligibility requirements is taken from socio-economic caste census. Apart from that, all those people who are not finding their names under socio-economic caste census, but they have been registered under the Rashtriya Swasthya Bima Yojana, then they are also covered under this. Now let's see the beneficiaries list. This will give you an idea that okay, what all are the peoples that are covered under Pradhan Mantri Jan Arogya Yojana. So beneficiaries under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana have been identified from the socio-economic caste census of 2011 on the basis of select deprivation and occupational criteria. Now, see, who are automatically included? People who are not having any kind of shelter, living on elms, means living on the help, as well as manual scavengers, primitive tribal group, legally released bonded laborers. Deprivation criteria in the rural areas has been given separately. Watch it over here. Only one room with kacha walls and kacha roof. No adult member between the age of 16 to 59. Female headed households with no adult member. Disabled with no able-bodied adult member, SC/ST households, landless households with a major part of their income from manual casual labor. So these are all the automatically included people under the health component of our Ayushman Bharat. We have automatically included under the scheme of PMJ. Now next is occupational criteria in the urban areas. Now all those people who are performing these kind of works in the urban areas, they are included under this particular scheme of Ayushman Bharat. That means your Jan Arogya Yojana. Rag pickers, beggars, domestic workers, street vendors, hawkers, other service providers who are working on the street, construction worker, plumber, mason, labor, painter, coolie, sweeper, sanitation worker, home-based workers, transport workers, drivers, conductors, helpers, rickshaw puller, shop workers, assistants, peon, electrician, mechanic, assembler, repair worker, washerman, and chowkidars. Now you can see from the list, these are all the people who are doing work for their living. They are, yes, they are earning, but their earning is not that much that if they have faced any problem related to secondary care or tertiary care, then they cannot meet that particular thing very efficiently. Hence, for that purpose, they have been included under the Jan Arogya Yojana. Now, PMJ is implemented in all states and UTs barring West Bengal, Delhi as well as the Odisha. These are the three states, UTs who are not have got under the Ayushman Bharat. Now there are some political reasons, some implementation reasons, as well as some what you can say, they consider, these states consider that the schemes that they are providing for the health related things are superior than the Ayushman Bharat. So that is also fine, but in my opinion, they should have come under this because of just one thing. I am not comparing all the other benefits that have been offered, but just one thing, that it is portable across nation, right? If there is a migrant worker who is working in different state, from if he is from West Bengal or Odisha, and if he is working in any other state, then also he can take the treatment related benefits. So that is the only thing that I can think of what makes Ayushman Bharat a truly national scheme. Now talking about National Health Authority. National Health Authority, very important. You should be remembering that who is the chairman of this particular authority. It has been constituted for focused approach and effective implementation. Earlier it was National Health Agency and it was reconstituted as an authority in the 2019. There is a governing board in order to govern this authority, and who is the chairperson? So Union Minister for Health and Family Welfare, and there are 11 members as well. It is headed by CEO and officer of the rank of secretary, right? Functions. Now one more thing, please do not get confused. We have got a governing board, and then see, I have already told you there are two components of anything. One is related to regulations, right? Like we make the rules and policies, and then we have also got an implementation arm. So if I talk about your National Health Authority, we have got a governing body who is responsible for seeing all the rules and regulations, whether they are implemented correctly or not, and the chairperson of this governing body is our dear Union Minister for Health and Welfare, Family Welfare, and there is a CEO as well. That CEO's work is to implement whatever is the mandate of National Health Authority, right? So please try to make the differentiation between these two. Do not get confused. Now let's see what are the functions of National Health Authority. You must have not what you can say very rocket science not there is. But what you can see over here is they have to formulate the operational guidelines related to the Jan Arogya Yojana, because we have seen that the National Health Authority is the implementing agencies of PM Jan Arogya Yojana. What does operational guidelines means? Government has made the policy. Government has said that these are the people who should be included. These are the benefits which we are going to provide. Now remains the on the ground implementation. If you are empaneling any private hospital, that what are the rules and regulations that they have to fulfill, right? Who are the agencies that are going to be do third party audits? So there are so many small things. For that the operational guidelines are required, and that will be made by the National Health Authority. Following up, central ceiling for premium or maximum central contribution for per trust. It determines that it ensures compliance with the standards for treatment. What quality of services you are being providing, that particular thing will be monitored by National Health Authority. And how they are going to monitor that? By doing the audits. Next is developing a pathway to converge PMJ with the schemes of various states, grievance redressal for all the stakeholders at various levels, and act as an apex body for central health agencies and all other activities whatever is given by the government of India. Now we have got two more things. One is your PM Arogya Mitra, and we also have got Ayushman Mitra. So who is PM Arogya Mitra? He is the health worker, right? It is a frontline health service professional who is going to provide you services under the PMJ. And then we have got Ayushman Mitra. So Ayushman Mitra is any person, any citizen of India who has got information of this scheme and who is helping the beneficiaries in order to get their desired and the eligible benefits, right? Anyone, any citizen of India can become Ayushman Mitra. Now talking about the next component that we have. What is that? Ayushman Bharat Health and Wellness Center. Now we have heard about PHCs, right? Primary Health Centers. So they do not have any other kind of work or any new kind of work apart from your primary health centers, right? The work that was being performed by primary health centers, they are also going to do the same kind of work, but there is a redesignation of the name and few of the things. Now earlier there was not a specific scheme that what needs to be performed under PHCs. Now they have created a list that includes the primary health checkup as well as the screening for other kinds of diseases as well. So hence there is not much of a difference under these, but let's see what are the key points under your health and wellness centers. So launched in 2018, the government of India has announced the creation of 1,50,000 health and wellness centers by transforming the existing sub-centers as well as primary health centers. Now with that particular information, I know that there is actually no functional difference between a primary health center as well as your health and wellness centers. That this is the point I am very clear of. Now what are the key points? They cover both, that means maternal child healthcare services, non-communicable diseases including free essential drugs. Key National Health Policy of 2017 that has envisioned that there should be centers as the foundation of India's health system. So by keeping that particular thing in mind, we have created Health and Wellness Center. What they do, they provide us the free essential medicines as well as diagnostic services, teleconsultation, promotion of wellness activities like yoga, meditation, Zumba, etc. So hence we have given that two components of health and wellness centers. These centers are going to provide you the service. First, Health and Wellness Center, it was launched by the Prime Minister in Bijapur, Chhattisgarh. The screening, prevention, management of chronic illness like non-communicable diseases, tuberculosis, leprosy, they have been part under the primary health system. And telemedicine guidelines, they have been provided to the states to initiate specialist consultations from the PHCs to the hub hospitals. Now see this thing. Thank you, Arindam. Now what we were trying to say over here is telemedicine guidelines. See, in India there is a WHO guideline related to the doctors and population ratio, right? But we are not fulfilling that as of now. So what is the option for that? How to cover, how to bridge that particular gap? So you have to give telemedicine a option and you have to create infrastructure for that. You must have seen or must have witnessed in the times of COVID, right? In the times of COVID, what happened was telemedicine was the only way for most of us until the time, see, until and unless you have got severe problem, then obviously hospitalization was the only way. Apart from that, even if you are sitting near or far, you can always go for telemedicines. So by keeping this particular thing in mind, now let's move on to our next component, that means digital health mission, right? We want to create a digital data repositories. There are problems in this particular scheme as well, like what we can think of is privacy breach. We still do not have a Personal Protection Data Act, right? So that is the only concern while creation of this digital format of health. But apart from that, everything is noble under this particular initiative. Now let's go back and study about it. Ayushman Bharat Digital Mission. So Prime Minister Narendra Modi, he announced the nationwide rollout of the Ayushman Bharat, right? It was launched in 2021. Budget was 1600 crores and duration is from financial year 2021 till 2026. What is the aim? We want to create a digital health infrastructure. Who is going to implement? National Health Authority. National Health Authority, we have already seen there is a governing body. Who is the chairman of governing body? Union Minister of Health. Now, key points. What are the key points under this? So this is the important thing, has been envisaged by National Health Policy. All the specific points from the Ayushman Bharat that has, first of all, a national policy was created in the 2017 and then we have acted on that particular policy. Next thing which is important is the aim is every Indian citizen should have a unique health ID, digitized health records with identifiers for doctors as well as the health facilities. Citizens will be able to create their ABHA. ABHA is full form Ayushman Bharat Health Account Numbers, to which their digital health records can be linked. Now, having just one number, you have to tell the doctor that this is my ABHA number. Now, doctor will be able to get all of your past records, like what's your age, what are your problems, were health related problems, what have been the previous diagnostic reports, right? What was the last date when you came for the checkup, and all the related things that will be mentioned in your digital health ID. You do not have to tell each and everything. Doctor will be having a record of everything of yours, and hence a suitable what you can say checkup can be provided to the patient. Now pilot phase, it was launched in some areas of our country, not very important. Now talking about the category of states. So in order to give the financial assistance to the state, we have divided the states under three categories: category A, category B and category C, right? Now states and UTs have been divided under this. On what basis we have divided them? We have divided on the basis of population. Why we have divided it? So on the basis of category, we are going to be providing the financial assistance that will be provided for approximately 5 for setting up state offices for ABDM, Ayushman Bharat Digital Mission, right? So please understand that there are 3 points important for you. First of all, for how long the assistance will be provided, it is going to be provided for 5 years, right? And as well as why you are dividing these states into categories. So in order to provide them assistance, and these states have been divided as per the population related criteria. Now talking about the important components under Ayushman Bharat Digital Mission. Let's see, first of all, you have got the health account. Obviously anyone who wishes to participate in this have their health records that should be digitally created. Aadhaar is a randomly generated 14-digit number. Please focus on the data. There are 14 digits number. If even you can create your 14-digit unique number from the Arogya Setu app also. This has been renamed as the Aadhaar. So now if you want to get the health related services, you just have to quote your Aadhaar number and you will be done. Next is healthcare professionals registry. If you want to see a doctor, see right now what we do, if I have to visit a specialist, right, I have to see the Google, and there are so many apps right now where you can access that, okay, these are the healthcare professionals or healthcare specialists available. But I do not have a government created registry that is going to tell me that who are the specialists in my areas. That will be a more authenticated data source, right? Because there are news every now and then. The batch on Unacademy has been proposed that it will be started from 6th of the March, right? Because notification is not out yet and hence it has been delayed every now and then. But we are expecting that we will be starting this from 6th of the March. Any information, you will be getting that in Telegram group itself. Fine. Now let's come back to the topic. So there was a recent news that in a respected reputed hospital, there were 2 doctors who were working without a professional degree. So you can understand that what is the level of problems that exists in health system. There are so many people like that who do not have a degree, but they are still operating on the pretext of being a doctor. And whenever we visit a doctor, we never ask for the professional degree. We never say that please show your UG or PG degree, in what areas you have specialized, do you have any kind of data in order to prove that. We never ask it. We just understand that okay, he has put up the board, then he or she will be a what you can say recognized doctor, or we can trust on him. So in order to remove this particular difficulty, and also in order to digitally identify that who are the health service providers in your particular area, this particular health facility registry as well as health professional registry has been created. Now it is a comprehensive repository of all healthcare professionals involved in delivery of healthcare services across both modern as well as the traditional systems. Traditional systems, that means your Ayush, of medicine. Enrolling in the healthcare professional registries will enable them to get connected to India's digital health ecosystem. And on a similar fashion, we have also got a health facility registry. Under this, both public, private health facilities, including hospitals, clinics, diagnostic laboratories, as well as imaging centers and pharmacies, everything will be having a digital presence. That means they can tell that okay, we are operating in this particular area, this is the kind of work we are performing, and hence it becomes easy for as a patient also in order to get access to these particular datas, right? Then we have also got a Abha mobile app. What we'll do with Abha mobile app, we can access our personal health records. We can always see them for ourselves. Next is Unified Health Interface. Unified Health Interface, this is a network. It is an open network and participating health service providers applications. It will enable a wide variety of digital health services between the patients as well as the service providers, like appointment booking, teleconsultations, service discovery, as well as the others. You can do so by using this particular interface. This is going to be working as a bridge between the patients as well as the service providers. Now talking about the Sehat scheme. So in 2019 we bifurcated the state of Jammu and Kashmir, right? So we have got a special component under Ayushman Bharat for Jammu and Kashmir. You see, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. And first let me tell you before starting this particular scheme, this Sehat, yes, it is a specific component. Why it is a specific component? Because we are focusing on a specific area of our country, that means Jammu and Kashmir. Apart from that, this is completely working in a form of Jan Arogya Yojana. It is working under the aegis of Jan Arogya Yojana. So you can understand that it is one of the component of PM Jan Arogya Yojana. Now what we will see under this particular Sehat scheme. So Prime Minister Shri Narendra Modi, he has launched Ayushman Bharat Sehat scheme to extend coverage to all residents of Jammu and Kashmir. All residents, right? The scheme provides free of cost insurance cover. It provides financial cover up to 5 lakh per family on a floater basis to all residents of the UT. It means that it can be used by one or all the members of the family. It is insured under one plan. Now this particular scheme, it will work in along with the PM Jan Arogya Yojana. That means there is not much of a difference, but just the location specific difference that has arisen. Now full coverage to the residents of J&K. At present, about 6 lakh families are getting the benefit of Ayushman Bharat, but after this particular plan, 21 lakh families will get benefit who are living in the UT of Jammu and Kashmir. The scheme, it is going to ensure the universal health coverage, affordable medical care, all that we have already seen. Now talking about Pradhan Mantri Ayushman Bharat Health Infrastructure. Now health infrastructure, what does health infrastructure actually means? So making the provision of the beds as well as the other facilities. They come under making provision of enough operation theaters. In the times of COVID, we have faced a severe crunch of hospital beds in the initial times, not in the later, because we have made alternative arrangements for that. But in the initial times, we do have faced the crunch of hospital beds, healthcare service professionals, as well as the cleaning related issues. Apart from that, the major infrastructure lag was oxygen cylinders. Correct. So these are called as the infrastructure, health related infrastructure, and hence we have included a component under Ayushman Bharat to provide the services related to the infrastructure as well. Now let's see it. Pradhan Mantri Atmanirbhar Swasth Bharat Yojana scheme, now renamed, has been renamed as Health Infrastructure Mission. This is the largest pan-India scheme for strengthening the healthcare infrastructure. See, the problem in healthcare is that we are not able to touch even a figure of 2% of GDP expenditure for health. And I'm talking about, if I talk about central alone, I'm not talking about states and central government together. You have to make an expenditure on the health in order to bring the outcomes. Now, launched in 2021. Outlay is 64,000 crores. Time period is till the financial year of 2025-26. Now focus will be on, if you read this particular focus clearly, you will be able to know that what we want to do under this particular scheme. So we want to focus at all levels, be it primary, secondary as well as the tertiary, on preparing health systems for effective response to current as well as future pandemics. Obviously, COVID-19 has given us a good lessons that your health infrastructure is really weak and you have to work on them. Infrastructure creation. We'll be building IT-enabled disease surveillance system, right? There will be laboratories at block, district, regional, national levels in metropolitan areas, strengthening health units at the point of entry for effectively detecting, investigating, preventing public health emergencies. The main interventions are, see, what are the main interventions? So under this, health and wellness centers in rural areas in 10 high focus states, 11,024 Ayushman Bharat Health and Wellness Centers in urban areas, 3,382 block public health units, setting up integrated labs in all districts, and establishing critical care hospital blocks in all districts with the population more than 5 lakhs. Now, with relation to everything that has been mentioned over here, has got a, what you can say, background. Like if I talk about labs, at the time of COVID, we were having one particular lab that was able to find out the genome of COVID, and that was located in Pune. And because of that particular thing, we did face a huge problem in the transportation as well as dissemination of data. So by keeping that into mind, now it has been envisaged that there should be an integrated public health lab in all districts of the country. So these are, you see, all of them together, they tell us the major focus areas on which we have to strengthen our health related infrastructure. Now talking about central sector components. Central sector components, 12 institutions will be there for training and maintenance with critical care hospital blocks, strengthening the National Center for Disease Control, expansion of integrated health information portal, setting up 15 health emergencies OTs, and setting up National Institution for One Health, 4 new institutions for virology, regional research platforms for WHO Southeast Asia region, etc. Do you guys understand what is the meaning of One Health? Anyone? I guess you must be knowing about it because this has been a majorly discussed topic. What is the meaning of One Health? Anyone? By the time you tell me the meaning of One Health, let's move ahead, right? We are going to establish a national institution on One Health. Now, why? See, do you understand that COVID-19 was a zoonotic disease? That means it transferred from the animals to humans. Now, as we are progressing, we are developing the infrastructure, etc. What we are actually doing, we are encroaching on the homes of these wild animals. So obviously, as humans and animals are coming together and they are close enough, right? Because of these all infrastructure developments and etc., we are concretizing the land as well as concretizing the jungles. So because of that, health of animals and humans, they have intermingled. Means if there are any kind of diseases that will be found in the animals, there are 99% of the chances that they for once they can get transmitted in humans as well. So we have to do research on all these kinds of zoonotic diseases that might emerge in the future and be ready for any kind of future pandemic that will occur. So this is the concept of One Health. Now talking about Surakshit Matritva Ashwashan Suman initiative under the National Health Mission. So when was it launched? It was launched in the October 2019. Under this particular Suman initiative, We want to provide the quality health care at no cost. There is zero tolerance for denial of services to any women and zero preventable new maternal as well as the newborn death. These are our aims. Now pregnant women as well as mothers up to the 6 months after delivery and all sick newborns, they will be provided free health care benefits like at least 4 antenatal checkups, 1 checkup during first trimester, at least 1 checkup under PMSMA, Surakshit Matritva Abhiyan, right? Iron folic acid supplementation, tetanus diphtheria injection and other components of antenatal care package. There will be no expense that needs to be incurred by the women and free transport from home to health institution along with zero expense delivery, drop back from the institution, elimination of any transmission of HIV, HPV and syphilis. So there was one particular instance also. In that particular instance, there was a woman in Tamil Nadu. She was transfused with the HIV infected blood. So these are various kinds of problems that occur, and hence by keeping that particular thing in mind, this particular scheme has been made. And what we want to do, we want to eliminate all these kinds of things that can happen, and we want to provide the zero cost healthcare to all the women who are there in the India. Next is your Mission Parivar Vikas. So it is basically related to the total fertility rate. We want to control our total fertility rate. India has already become the most populous nation on the earth, and that is good in some ways because we will be having more people who are working for our country, but at the same time you have to provide education, you have to provide health to all these people so that they can work at their full efficiency. And believe me, there is a capacity of the land that how much people it can bear, right? So please we are trying that we should not extend beyond that because we want people who should be having a quality of life. So with that particular initiative, this particular Mission Parivar Vikas was launched in 2016, notified from 2017. What is the aim? So we want to provide the access to contraceptives as well as medical planning, family planning related services in 146 high fertility districts which are having the total fertility rate of 3 and above, right? TFR, let me tell you once again, what does TFR means? Yeah, but no, we are progressing by looking at our colonial history. Yes, we are performing very well, but there are some problems at the policy level and etc. Some problems are there at the education level. If we can see that there are so many people who are outshining and who are making us proud outside India as well. That means we do not have any dearth of good minds, but what we just have to provide them good facilities, right? Now let's just complete this quickly. So total fertility rate is the number of children that a woman will bear during her reproductive age, right? So we want to bring it down at a replacement fertility level. That means if I talk in crude terms, we want that every woman should be having just 2 children. Right. So currently there are districts in these particular states which are having a TFR of 3 or more. That means the women in these areas, they are having children's 3 or more children. Now what are these areas? UP, Bihar, Rajasthan, Madhya Pradesh, Chhattisgarh, Jharkhand, Assam. That constitutes 44% of the population. Please understand, Assam is will be here because out of the 7 sister states, Assam is the most populous one. So with that particular thing, and what we are incentivizing, we are providing ASHA with the incentives and beneficiaries also incentives if they are receiving the doses of contraceptives. So with that, I'll be wrapping up this particular session. Most probably tomorrow we will be able to complete our Ministry of Health related schemes, right? Thank you so much for joining in, and if you have liked this video, please do not forget to hit the like button. Thank you.